Hey guys, I am Joy and you are watching my YouTube channel Universal Joy. In this video, we'll be talking about one of the most important bones of our body, that is hip bone. So we'll be learning about hip bone. But before moving into the depth of the video, if you are new to this channel, then your first honors is going to be to get yourself subscribed to our channel and hit that bell icon below as well so that you don't miss any single video of our channel. Now without much further ado, let's just get into the depth of this video. Now in this video, we'll be talking about this hip bone and we'll be also learning about the presenting parts of these hip bones. That means the surfaces, the borders and the ends that this hip bone possesses, and we'll also be acquainted with its anatomical points, how to hold this hip bone in the anatomical position, and besides that we'll be also learning the attachments of this hip bone. That means this hip bone is going to be providing attachment to various muscles, various ligaments, various tendons. So we'll be learning about those attachments, and at the same time we'll be learning about its relation. That means this hip bone is going to be related to certain viscera, it's going to be related to certain vessels, nerves. So we'll be learning almost all those stuff in this video. So let us just start our journey. We'll be learning about the parts of this hip bone. Basically, hip bone is composed of three different important bones. One of them is ilium. So basically this broad fan shaped part that you can appreciate over here, this part is known as ilium, and this is small portion which is indicated by my index finger. This portion of this hip bone, it is going to be indicating the pubis bone. So basically this is the pubis bone. It is relatively smaller as compared to the ilium and ischium. So between ilium and pubis there is this part, this bony portion is known as ischium. So again, it's composed of three different bones. One is ilium. This broad fan shaped part is known as ilium. This small portion is known as pubis, and between ilium and pubis, this intermediate portion it's known as ischium. So ilium, ischium and pubis, when these three bones unite with one another, they result in the formation of this entire matured hip bone. Okay, now this we'll start our journey with the ilium. So basically this ilium, it has got two ends, three borders and three surfaces. So two ends include the upper end. So basically this is the upper end that you can appreciate over here. This is the upper end, or you can sometimes compare this upper end with the iliac crest. So iliac crest and upper end indicate the very same thing, and in opposite of this iliac crest, the lower the end that you can appreciate over here, this is known as lower end. So basically this constricted area above the acetabular cavity, this is known as lower end. So we have already learned the two ends. This is the upper end, and in opposite of this broad upper end, we'll get to see the lower end, and it has got three different surfaces and three different borders. So basically this is the anterior border. This is the anterior border. So it starts its point from the lower portion of the anterior superior iliac spine, then runs downward, faces a concavity, then again faces a tubercle-like structure known as anterior inferior iliac spine, then again it runs downward and it merges with the acetabular cavity. Now this is the extension of the anterior border. Okay, now this is the now we have to learn the posterior border. So this is the posterior border. So basically it again starts from the point of posterior superior iliac spine. So basically this point indicates the posterior superior iliac spine. From there on, it again runs downward and faces another spine-like structure that is known as posterior inferior iliac spine, and from this posterior inferior iliac spine, it again runs downward and it merges with the greater sciatic notch, and then it becomes continuous with the posterior border of the ischium. So what we have learned up to now, we have learned two different borders. One of them is anterior border. This is the anterior border. We have learned its extension as well, and in opposite of this anterior border, this is the posterior border, which ultimately becomes continuous with the posterior border of the ischium. Then we have to also learn about the medial border. So basically this is the medial border. You can appreciate over here, that is the medial border, which is going to be separating the iliac fossa from the sacropelvic surface. Basically this is the medial border, and this medial border is going to be terminating at the point of the iliopubic eminence, and that will be continue, and this medial border later on will be continuous with the linea terminalis, which will come across a bit later on. So we have learned the extensions of all the three borders, and this iliac crest, sometimes it is called as the upper border or superior border. And what is its extension? It starts from the point of anterior superior iliac spine, then moves backward and terminates at the point of the posterior superior iliac spine. So basically this is the extension of the iliac crest, or you can tell it to be this is the extension of the upper end, or you can tell it to be this is the extension of the superior border. Okay, then we have to understand the three surfaces that this ilium possesses. One of them, this concave surface that you can appreciate over here, it's known as iliac fossa. This concave surface is known as iliac fossa. Okay, And that means iliac fossa is a confined space between the anterior border and the medial border of this ilium bone. So this is called iliac fossa. Okay, and in opposite of this iliac fossa, we'll get to see a large surface that is known as gluteal surface. So this is the known as gluteal surface. Okay, why is it called gluteal surface? Because it's going to be providing attachment to gluteal muscles, gluteus maximus muscle, gluteus medius muscle, and gluteus minimus muscle. That's the major reason why it is known as gluteal surface. Okay, and there is another surface left out, that is known as sacropelvic surface. So basically this is the sacral part and this is the pelvic part, and both these things put together will be forming sacropelvic surface. That means a small portion of the pelvic surface of the ischium will be falling under the area of the sacropelvic surface. Okay, and the sacropelvic surface is composed of two different parts. One is sacral part, another one is pelvic part. This one is the pelvic part, and the sacral part, again, it is subdivided into two different subdivisions. One of them is auricular surface. This one is the auricular surface, and another one is the rough surface, or it's also known as iliac tuberosity. Okay, so this one basically is the iliac tuberosity, and this one is also known as auricular surface. Why is it called as auricular surface? Because it is going to be almost akin to the shape of the external pinna of the ear. That is the major reason why it's known as auricular surface. Again, it's going to be giving the shape look like almost similar to the feature of the external ear. That is the reason why it is known as auricular surface. So basically this auricular surface is the articular portion. This is the articular portion, and is going to be articulating with the sacrum, making a joint that is known as plain variety of the synovial joint. More specifically, the upper portion will be fibrous joint and lower portion will be plain variety of the synovial joint. But as a whole, we call it to be approximately plain variety of the synovial joint. And above the level of this auricular surface, we'll get to see a roughened area, and this roughened area is known as iliac tuberosity. Basically, this is rough because of the attachment of three different important ligaments, which we will come across a bit later on. So this is all about the presenting parts of the ilium. So another thing that we have to learn is that just 4 to 5 centimeter behind and above the level of this anterior superior iliac spine, we'll get to see a tubercle like area, that means a bony projection directed a little upward. This part is known as a iliac tubercle. Okay, this part is known as iliac tubercle. So basically this point is known as iliac tubercle, which is situated approximately 4 to 5 centimeter behind and above the level of the anterior superior iliac spine. So this is if it is anterior superior iliac spine, then from here on we have to move 4 to 5 centimeter a little backward in order to get to the point of the iliac tubercle. So this is basically all about the presenting parts of the ilium. Now we have to understand and learn the attachments of this iliac crest. So iliac crest and this entire ilium bone. So basically this iliac crest, let's just move into the depth of this iliac crest. Okay, this iliac crest, it is divided into two different parts. One of them is ventral part, another one is dorsal part, or more specifically or theoretically it's called ventral ventral segment, and this is the dorsal segment. Okay, the ventral 2/3 is called ventral segment, the dorsal 1/3 is called dorsal segment. Okay, now this ventral segment, it can be divided into three different important areas as well. Now the outerly, there will be the outer lip, innerly there will be inner lip, and in between outer lip and inner lip will be appreciating another space that is known as intermediate zone. Again, I'm going to be indicating with this pen so that it can be understood by you very well. So see, outerly there is the outer lip. So basically this is the outer lip of the ventral segment. Okay, ventral segment of which part? Ventral segment of the iliac crest. Okay, innerly there is inner lip. So this is the inner lip. Okay, this is the inner lip of the ventral segment of the iliac crest, and in between this inner lip and outer lip, this space is known as intermediate zone. Okay, now this outer lip, it's across the whole extent of this outer lip of the ventral segment of this iliac crest, it will be providing attachment to fascia lata. What is fascia lata? It is nothing but the deep fascia of the thigh. So across this whole extent of this iliac crest, I mean to say across the whole extent of this ventral segment of this iliac crest, it will be providing attachment to the fascia lata, and medial to the fascia lata. Medial to the fascia lata, between the anterior superior iliac spine and the iliac tubercle, there will be the attachment of the tensor fascia lata. So this part will be providing attachment to the tensor fascia lata. This part will be providing attachment to the tensor fascia lata, which is a small muscle. Okay, tensor fascia lata, and medial to that, in the anterior 2/3 of the ventral segment of this iliac crest, it will be providing attachment. More specifically, it will be providing insertion site for the external obliquus abdominis muscle. Okay. Then medial to that, in the anterior 2/3 of the intermediate zone of the ventral segment of this iliac crest, it will be providing origin to the internal obliquus abdominis muscle. That means this intermediate portion will be providing origin to the internal obliquus abdominis muscle, and medial to that, in the anterior 2/3 of the in the anterior 2/3 of the inner lip of the ventral segment, it will be providing origin to the transversus abdominis muscle, and deep to that, there will be the attachment of the fascia transversalis and iliacus fascia, and in the posterior 1/3 segment of the ventral segment of the iliac crest, in across this inner lip, it will be providing attachment to the quadratus lumborum muscle. So this is all about the attachments of the ventral segment of the iliac crest. Now what about the attachments of the dorsal segment of this iliac crest? Basically, dorsal segment will be having one outer sloping part and inner sloping part, and this outer sloping part, inner sloping part will be separated by a ridge. Okay. So this outer sloping part, it will be providing attachment to gluteus maximus muscle, and this inner sloping part, it will be providing attachment to erector spinae muscle or sacrospinalis muscle, which is the largest muscle of the back. And this is the attachment. This is all about the attachment of this the dorsal segment of this entire iliac crest. Now, as we have learned about the attachments of the iliac crest, let us just move into the anterior superior iliac spine and anterior inferior iliac spine. So basically, this is the anterior superior iliac spine. It will be providing origin to one muscle and origin to one ligament. What is the origin of the muscle? So basically, from this particular position, it will be providing origin to one muscle that is known as sartorius muscle. So sartorius muscle is the longest muscle of our entire body. It is approximately 45 centimeter in length. And what are the other structures which will have 45 centimeter in length? Okay. The sartorius muscle, apart from sartorius muscle, there will be thoracic duct, which will be 45 centimeter in the length. Spinal cord, again 45 centimeter in the length. So this way, there are some homologous structures which are approximately of the same length. Okay. Then it will be providing origin, that means anterior superior iliac spine, it will be providing origin to that ligament that we have sartorius muscle and one ligament. The ligament is lateral head of the inguinal ligament. Okay. And below the level of the anterior superior iliac spine, this bony landmark, it indicates the anterior inferior iliac spine. So this anterior inferior iliac spine, it will be providing attachment to one muscle and one ligament. So basically, the ligament is iliofemoral ligament, the strongest ligament of the hip joint. So that is strongest ligament of the hip joint, that is known as iliofemoral ligament. That ligament will be attached to this particular part or this particular bony projection, and then there will be one muscle which will be attached to this particular place as well. The straight head of the rectus femoris muscle. Basically, straight head of the rectus femoris muscle will be taking its origin from this bony projection. So rectus femoris has got two different heads. One is straight head, another one is reflected head. So straight head of the rectus femoris muscle takes its origin from this anterior inferior iliac spine, and reflected part of the rectus femoris muscle, it takes its origin from an area situated between the inferior gluteal line and above the acetabular cavity. So that means this area will be providing attachment, or rather I should be saying origin, to the reflected part of the rectus femoris muscle, which will be coming across a bit later on. So what we have learned up to now, this anterior superior iliac spine providing origin to the sartorius muscle, and it's also providing origin to a ligament that is known as lateral head of the inguinal ligament. This anterior inferior iliac spine providing origin to the ligament that is known as iliofemoral ligament, and a muscle that is known as straight head of the rectus femoris muscle. Then this is the posterior superior iliac spine and posterior inferior iliac spine. So posterior superior iliac spine will be providing attachment to a ligament that's known as sacrotuberous ligament, and this posterior inferior iliac spine will be again providing origin to the sacrotuberous ligament. So basically, the sacrotuberous ligament, it is a longitudinal type of the ligament which runs directly downward, and it crosses with the horizontal ligament that is called sacrospinous ligament, which is going to be attached to this ischial spine. So from this ischial spine, the sacrospinous ligament will be running horizontally, and from these two posterior superior iliac spine and posterior inferior iliac spine, that sacrotuberous ligament will be running downward. So they will be crossing with each other, and ultimately due to their crossing with each other, this greater sciatic notch and lesser sciatic notch will be converted into two different foramen, and they will be converted into greater sciatic foramen and lesser sciatic foramen. So basically, this is something which will be coming across in the next video. So but up to now, as of now, we have to keep only one thing in your mind is that this posterior superior iliac spine and posterior inferior iliac spine, both of them collectively they provide the origin to the sacrotuberous ligament, which runs downward, and ultimately they cross it crosses with the horizontal sacrospinous ligament, which is attached to the ischial spine. Anyways, now this is all about the attachments of the spines. Okay, now we have to understand the attachment of this iliac fossa. The upper 2/3 of this iliac fossa will be providing origin to the iliacus muscle, and at the inferior aspect of this iliac fossa we can appreciate a hole. That means we can appreciate a foramen like structure. So basically this is that foramen. This small foramen is nothing but because this small foramen is nothing but the foramen for the nutrient artery. Okay, that means nutrient artery will be piercing through this space. That is the major reason I will get to see a foramen like structure on the inferior on the iliac fossa. So this is the branch of the iliolumbar artery. This nutrient artery is the branch of the iliolumbar artery. So basically in the entire hip bone we will be able to see 4 different foramen. This is the obturator foramen, okay, and this is the greater sciatic foramen, which will be converted this is the greater sciatic notch, which will be converted as foramen due to the crossing of the 2 ligaments. This will be the lesser sciatic foramen, and this is the nutrient foramens. Okay, so that means there are 4 different foramen. Anyways, then what is the relation of this iliac fossa? Okay, in the right iliac fossa, as this is the left hip bone, so in the left hip bone there will be sigmoid colon and descending lower part of the descending colon as well. And in the right iliac fossa there will be the viscera, like there will be appendix and cecum. So these are the visceral relations of this iliac fossa. And now coming to the sacropelvic surface. So this this roughened portion of the sacropelvic surface, it is known as iliac tuberosity. So basically this is rough because of the attachment of 3 different important ligaments. What are those 3 different important ligaments which you have to come across right now? One is iliolumbar ligament. So it's going to be connecting the lumbar vertebra with the ilium. That's why it's called iliolumbar ligament. Then dorsal sacroiliac ligament. That means it's going to be connecting, this ligament is going to be connecting the sacrum with the ilium. Okay, that's why it's called as dorsal sacroiliac ligament. Then interosseous sacroiliac ligament. Now as you have these are the 3 ligaments which will be attached to this particular place. Now as you have mentioned about dorsal sacroiliac ligament, that means there has to be the presence of ventral sacroiliac ligament. Now where will that ventral sacroiliac ligament be attached to? So basically this is called preauricular sulcus, just below the level of the sacropelvic surface. This is known as preauricular sulcus, and over this over here there will be the attachment of ventral sacroiliac ligament. So basically in the parasomen this ligament becomes stressed out and it becomes more conspicuous and more prominent. Okay, anyways, then let us just get into the dorsal surface or the gluteal surface. Basically this gluteal surface of the ilium, it can be divided into 4 different spaces by the presence of 3 different lines. Okay, one of them is posterior line, another one is anterior line, another one is inferior line. Amongst these 3 lines, the anterior line is the longest one, the inferior gluteal line is the most ill-defined one, and the posterior line is the shortest one. Okay, now how to draw these lines? Basically this posterior gluteal line, it should be drawn from a point situated 4 to 5 centimeter in front of the posterior superior iliac spine up to the upper part of the greater sciatic notch. So let's just suppose that this is the point which is situated 4 to 5 centimeter in front of the posterior superior iliac spine. Because if we consider this to be posterior superior iliac spine, then from this position we have to move 4 to 5 centimeter in front, and then from there on we have to move along and reach up to the upper part of the greater sciatic notch. Let's just suppose this is the upper part of the greater sciatic notch, and then after getting into this position, if we just connect the primordial point with the ultimate point, then we'll be able to get to see a line, and this line is called posterior gluteal line. So basically this is the posterior gluteal line, which is the shortest amongst the 3 different gluteal lines. Okay, then this is the anterior gluteal line. Basically it is drawn from a point which is situated at the tubercle of the iliac crest, or you can say this is the point, this is the line which has to be drawn from a point situated 4 to 5 centimeter behind and above the point of the anterior iliac spine, anterior superior iliac spine. So if it is anterior superior iliac spine, from this particular position, if we move 4 to 5 centimeter behind, then we'll be able to get to see a point over here, and this point is going to indicate the presence of the tubercle of the iliac crest. So from that point we have to move longitudinally downward up to the middle of this greater sciatic notch. Then we'll be able to get to see this ultimate line. This line is known as anterior gluteal line. This is the longest amongst all the 3 gluteal lines. Then this is the inferior gluteal line, which is the ill-defined one. Okay, it starts its journey from the anterior inferior iliac spine, and then the last point or the terminating point has to be drawn at the apex of this greater sciatic notch. And if we connect both the points, then we'll be able to generate this inferior gluteal line, which is the most ill-defined one. And due to this presence of these 3 different gluteal lines, we'll be able to divide this gluteal surface into 4 different spaces. Okay, so the space of the gluteal surface situated behind the posterior gluteal line, this space will be providing origin to the gluteus maximus muscle. Okay, the space between the anterior gluteal line and the posterior gluteal line, this space will be providing attachment, or rather I should be saying origin, to the gluteus medius muscle. Okay, again the space behind the posterior gluteal line will be providing origin to the gluteus maximus muscle. The space between the anterior gluteal line and posterior gluteal line will be providing origin to the gluteus medius muscle. The space between the anterior gluteal line and inferior gluteal line, this space will be providing origin to the gluteus minimus muscle. And below the level of the inferior gluteal line and above the level of the acetabular cavity, this space is going to be providing origin to the reflected part of the rectus femoris muscle. Remember, we have already mentioned that straight head of the rectus femoris muscle was taking origin from which spine? Anterior inferior spine, anterior superior, anterior inferior iliac spine, and the reflected part of the rectus femoris muscle is now going to be taking its origin from the this space which is situated above the acetabular cavity and below the level of the inferior gluteal line. Okay, so basically this is all about the attachments of this ilium bone. Another thing that we have to learn is that basically this acetabular cavity, okay, how is it formed? The upper 2/3 portion of this acetabular cavity is formed by the lower end of this ilium. The posterior inferior 2/3 of the posterior inferior 2/3 of this acetabular cavity is formed by the ischium, and upper and anterior 1/3 of this acetabular cavity is formed by the pubis bone. So this is how this acetabular cavity is formed. Okay, now another thing that we have to learn is that this is as we have learned about ilium today, in the next video we'll be learning about the ischium and pubis. But before getting into the next video, we have to understand about these anatomical points and how to hold it in the anatomical position. So basically, first of all, the notch between our thumb finger and the index finger, this notch should be placed in the greater sciatic notch of the hip bone, like this way. Again, the notch between the thumb finger and the index finger should be kept in the greater sciatic notch, and this upper margin or upper portion of this index finger should be placed in the concavity between the anterior superior iliac spine and this anterior inferior iliac spine. Again, the notch between the thumb and the index finger will be placed in the greater sciatic notch of the hip bone, and this upper portion of this index finger should be placed in the concavity situated between the anterior superior iliac spine and anterior inferior iliac spine. And then and only then we'll be able to hold this hip bone very firmly. And then we have to mention its anatomical positions. This anterior superior iliac spine and the pubic tubercle lie in the same anatomy, they lie in the same coronal plane. This is the coronal plane which will lead to the division of the trunk into anterior compartment and posterior compartment. Anyways, first of all we'll have to say its side, then we'll have to jump onto its anatomical points. So basically, this is the hip bone of the left side. The anterior superior iliac spine and the pubic tubercle lie in the same coronal plane. This ischial spine and the pubic tubercle lie in the same horizontal plane, or you can say that this ischial spine and the upper margin of the symphysis pubis lie in the same horizontal plane, and this symphysial surface of the pubis lie in the median plane, or it lies medially, and the acetabular cavity is directed downward, forward and laterally. So these are the 4 points which you have to mention during the time of the anatomical points. Again, anterior superior iliac spine and the pubic tubercle lie in the same coronal plane. Ischial spine and the upper margin of the symphysis pubis lie in the same horizontal plane. Acetabular cavity is directed downward, forward and medially, and the symphysial surface is directed in the median plane, or you can say symphysial surface is situated medially. So this is all about the anatomical points of the entire hip bone. Now, as we have learned about the parts, attachments and relations of the ilium bone, now in the next video we'll be talking about the presenting parts and the relations and attachments of the ischium and pubis bone. Now I hope that this video has made all of your doubts clear about ilium bone and also the superficial parts of the hip bone. Now if you have liked the video, then please be subscribed to our channel and also share this channel with your friends. This is Joy signing off from today's video.